using culturally and linguistically appropriate services to improve delivery of care. Introduction. Breakdowns in communication can equate to breakdowns in the quality of care and patient safety. According to the Agency for Healthcare Research and Quality, nearly 80% of information shared during outpatient visits is immediately forgotten by patients. Information retention and comprehension can be greatly improved by taking actionable steps that support health literacy and address the individual needs and preferences of all patients. Check out the following scenario to determine an approach that would best improve communication, comprehension, and support patient safety. Home dialysis scenario. Anna, a 48-year-old female patient from the Dominican Republic, developed kidney failure and was referred to a home dialysis program for peritoneal dialysis training. Anna's primary language is Spanish, and she does not speak or understand English. To help Anna learn and understand peritoneal dialysis, her 13-year-old son, who's fluent in English, served as her interpreter during the 2-week training. A week after the training, Anna arrived at her dialysis center's home program with a waterborne organism exit site infection. After reviewing Anna's exit care done at home, it was found that Anna's son missed specific details that he did not think were necessary to relay to Anna. Making the connection. In this scenario with Anna, we can see how a breakdown in communication resulted in a patient safety issue, reduced quality in the delivery of care, and created inequitable care. But let's dive deeper into how the breakdown in communication shows up in Anna's care. Access to preferred language services is a fundamental component of care for patients with limited English proficiency. Despite having a right to receive all information in a way that she can understand, Anna was not offered access to a qualified medical interpreter. Most organizations advise against the use of patients' family and friends serving as interpreters. Why? Because as we see in Anna's case, the potential for more harm than good can occur. Use of Spanish-speaking family, and even non-certified bilingual staff, as ad hoc language interpreters have resulted in increased patient safety issues, such as medication errors, wrong procedures, avoidable hospital admissions and readmissions, and other adverse events. Non-certified bilingual staff differ from qualified medical interpreters in that qualified medical interpreters undergo a special training, demonstrate proficiency in speaking and understanding both the source and target language, are able to assist with nonverbal clues, and can provide accurate medical interpretation, be it in person, over the phone, or virtual. To provide equitable and quality care that honors patient needs, learning styles, and preferences, dialysis organizations should make qualified medical interpreters accessible and offer services in a patient's preferred language. Whether or not bilingual staff is available, it is imperative to have systems and processes in place for accessing qualified medical language interpreters. Lastly, as we highlight the communication breakdown in Anna's case, the scenario does not indicate that the home program professional employed strategies like teach back and ask tell ask to validate understanding of the information being shared with Anna and her son. We've identified some of the ways in which a breakdown in communication resulted in a patient safety issue for Anna. Now, let's focus more closely on how to prevent communication breakdowns that can exacerbate inequitable care, healthcare disparities, patient safety issues, and poor quality of care. Let's think about Anna's encounter. She experienced a lack of culturally and linguistically appropriate care. Her provider failed to provide equitable and understandable services that took into account Anna's preferred language, health literacy, learning style, and other communication needs. This led to a medical complication. Anna's experience illustrates how CLAS can enhance clinical interventions and treatments. Implementing national CLAS standards in the dialysis setting. Delivering culturally and linguistically appropriate services, CLAS, is as important to patients' mortality, morbidity, and quality of life as clinical interventions and treatments. To operationalize national CLAS standards, dialysis professionals can use the implementation checklist for the national CLAS standards. First, review each practice or standard from the checklist and self-assess your dialysis facility's current actions against the practices listed. Don't overwhelm the team by choosing too many practices to test and implement at once. decide on 1 to 3 practices your facility would like to implement. Consider how success will be measured. Lastly, not all change is an improvement. Monitor the changes, both good and bad, that you see as a result of implementation. Take time to adjust, abandon, or adopt changes as needed. For more information, please watch What are culturally and linguistically appropriate services, or contact us today.